Okay, I am in my car, but I wanted to do a first impressions after having, I know that that's usually for makeup, but whatever. I wanted to do a first impressions after having met with my nurse practitioner, the nurse practitioner that I'm working with to manage my diabetes at the diabetes clinic. I wanted to do it before I forget. And so yes, I'm in my car, but please don't text and drive, don't video and drive, don't do anything except for change the radio station and drive. Anyway, I really, really liked her, and I kept wanting to just like get up and hug her because I was like, she's gonna help me. I have a lot of mixed emotions. Mostly I'm really excited. There are a lot of things I'm really excited about. Since the last time that I went to the diabetes clinic, a lot of things have changed for the better in diabetes management. One of the things that I am the worst at is keeping track of literally anything. I have ADD, and it is really hard for me to consistently track things, because it's like I'll do it when I remember, and then it'll be like 2 weeks later and I just barely remembered, and I'm trying to catch up on 2 weeks of information. Anyway, so I got this little monitor that just kind of clipped on. It's like this big. It's tiny, and it's a little circle, and she just clipped it onto the back of my arm, and it's going to monitor my blood sugar day and night for 2 weeks, and then at the end of 2 weeks it needs to get replaced. That's what I'm most excited about, because it will be continuous monitoring of my blood sugars, and kind of like and obviously time of day will be relevant and things like that. And there's an app, and it'll beep at me. So there's an app that I can download on my phone. It'll beep at me if my blood sugar is too high, if it's too low, but I'm not gonna have that problem because my blood sugar is be high for a long time, you know what I mean? Anyway, I felt really grateful. And I kept wanting to cry because of all the damage that I've done to my body just by neglecting it. And I just thought of how many times over the past almost like 4 years I've thought about going back to the diabetes clinic and never did, and should have. But you know, there's no time like the present, and I'm really glad that I went. And she was so nice. And I talked to her about my like different symptoms that I was having, and the reason that I went in, and my body like falling apart. And she didn't scold me. She wasn't mean to me. She didn't, I don't know, like kick me in the shins because my body's falling apart and I've let it. But she just said, you know, no time like the present. Let's work on getting this down, and it'll be okay. And that was really comforting to me. And I don't know that it would have been really appropriate, but I just wanted to hug her and just thank her. And so there's a lot of things that I have to take medicine wise to get my sugars to a healthy level, I feel like it's just gotten so out of control. But anyway, don't delay. Go in, make an appointment. I'm the worst at making appointments because I don't like to call. I don't like being on the phone and being like, hey, I just have a question about it. It makes me feel awkward, but just do it. Nobody's gonna care. And like I said, I'm very excited about these new treatment options. I'm very excited that my insurance covers them, or should cover most of them. I guess we'll see. There's some that needed prior authorization, but I'm really excited to feel good, to not be lethargic my entire day without, you know, just having to drag myself around to get basic things done. So anyway, first impressions, great, ecstatic, very happy, very excited, a little bit nervous. Nervous for the damage that I've caused by my neglect, and just kind of nervous about the long road ahead. But you know, one day at a time, one step at a time. And for now, I've got my monitor on, and so now I don't have to worry about pricking my finger and writing stuff down. Anyway, that's it for now. Bye.